How Scarless Gynecomastia surgery is possible in India? Gynecomastia or man boob is one of the most common problems among the males in India. In one study, it has been suggested that 1 in 5 males can be facing the problem of gynecomastia or enlarged male chest. Well, that is why gynecomastia surgery remains one of the most popular procedures that we do as an Indian surgeons, as we receive patients from world over. Now, the important thing is to realize that it is possible to do gynecomastia surgery in a way that scar is not visible. Now we have the latest technologies in India which ensure that you get good results, a sculpted chest along with the hidden scar. To understand what exactly I am saying, let's watch this video. Now, first of all, what is gynecomastia? Gynecomastia means gyno, that female-like chest enlargement, in which you have the gland along with the fat that gives appearance of a sharp pointed nipple along with the very heavy chest. Traditionally, gynecomastia has been treated by using liposuction. If the gland is too large, then we give a cut around the black portion of the nipple, that is the areola. It is well hidden in the semicircular fashion that is given, and we take out the gland and ensure that the fat also is taken out completely. Now, this has been the traditional approach which has remained the gold standard for a very long time. It does have an impact on each and every surgery that we do, and I also practice this approach in the right candidate. But as the time has evolved, so is the technology. There was a time when we were removing the gallbladder with an open approach with a very big scar. But now the technology allowed us to do it very laparoscopically. That is a very minimal scar that is hardly visible. And the techniques also have evolved so much that surgeons can now do it robotically also, reducing the recovery time plus reducing the scarring also. This approach also we have applied to gynecomastia, in which we do not give any cut in the front of the chest or the nipple region, but on the sides. Now, what this does is it reduces the scarring as it is not visible in the armpit area. Secondly, it reduces the recovery time as we are using latest technologies like power assisted and ultrasonic liposuction. Thirdly, you can go confidently without any telltale signs of the surgery. Now, these three remains the main pillars of our Scarless Gynecomastia approach, which is now available in India. The important thing is to understand that the Scarless Gynecomastia approach involves just a very small cut, that too in the sides, in which we give the fluid first to emulsify the fat by using ultrasonic liposuction. Then we use power assisted liposuction tool to take out the fat. Now, these does two things also. First of all, taking out the fat. Secondly, breaking the gland also. This allows us to take out the gland from the side port or the side region only without giving a main cut on the nipple. And therefore the gland can be taken out piecemeal, thus making sure that we are taken out the complete gland. Now, after the completion of the process also, we make sure by pin technique or by ultrasound to make sure that complete gland has been taken out. This also reduces the probability of the crater deformity which can be there in the open technique also, in which you can take out gland with too much of the fat which is the overlying the muscle. Now, it is very important to know the anatomy of this to do this Scarless approach. In the anatomy of the gynecomastia, we understand the fact that around the nipple region, there are multiple layers beneath that. Beneath the nipple is a very superficial layer of the fat, below which there is a gland, hard tissue. Below that, there is another layer of fat pad, and then there is the muscle. In gynecomastia, we never take out the fat which is just above the muscle, as it will create a crater or the saucer-shaped deformity. Now, the open technique also does not ensure that if you don't know the anatomy, you can take out excess amount of fat also, which can deform the chest. These are the advantages of the scarless approach of gynecomastia. That means the hidden scar approach of gynecomastia than the traditional approach. I do use traditional approach also in some cases in which the gland is very much hard by the sideway approach to take out the complete gland. Secondly, in the cases of steroid abused gynecomastia, that means steroid induced gynecomastia, I use the open approach because the gland is too hard or stuck. But in the maximum number of cases, we do it from the side port only to ensure that there are no telltale signs of surgery. If you have any doubts or query related to gynecomastia or gynecomastia surgery, we'll be more than happy to help you out. This is our gynecomastia helpline. You can contact us on this number or WhatsApp on this number. Plus, we have an exclusive website for people who are suffering from this problem. Do check this out at www.gynecomastia.co.in. Thank you so much for watching this video.